here in Bakersfield Smile Design, the reason why I've named it Smile Design is because we do just that. First of all, we let the patient, along with me and my staff, we all work together as a team, helping them to let them design their smile. So we actually have some material the patient can look through, and they can make comparisons, and they can actually just say, you know what, I like the way that looks. And we actually show the patient, different tooth styles, the different way things look, different tooth shades, and we give them options. We have a definite goal in mind, but there's definite steps in this process along the way. And when we put the patients in the temporary crowns or veneers or whatever the case may be, it gives the patient then the opportunity. First of all, we want them to look good. All right, we don't want them to be embarrassed during that time. We want them to feel like they can start smiling right away. And remember, bear in mind, at the beginning, when we very first started talking about doing it, we were thinking with the end in mind. So when you do get your permanence, that you're getting what you want, and that's really the goal. One of the biggest problems that she's had is that this space between this central and this lateral has always been too great. So, and of course, you've got this whole shading thing going on in the gingiva. So that one's open just a little bit more down. This one's going to be a full cover, so what we want to try to do obviously is make everything blend together, and we've been real successful in getting the veneers and the full coverage to all work together. And because what's happened, this has been replaced for her several times, this particular tooth, and the problem just keeps getting recycled. And so for once and for all, we're going to eliminate that problem and give her a beautiful smile that goes from the corner to corner. Okay. So it'll be veneer on all of these, and then a crown that blends in with the veneers perfectly on that tooth. To maximize my patient's smile, it's critical to have a hands-on relationship with the lab. Having our lab technicians come in on patient visits really increases the ability to deliver a beautiful smile. We've talked about a lot of things. We've talked about designing the smile. We've talked about the things leading up to that, and we understand that an important consideration for people is the cost. And you might be surprised, cosmetic dentistry and their services are actually more affordable than you may think. And the only way, you need to come in and you need to find out. And we have all kinds of options available, different ways that you can finance it, different ways that you can pay for it, so that you can get what you want. And so far we've never had anybody who's ever come in and said, Dr. Krauss, I wish I hadn't have done this. No, actually the opposite is the case. Everybody is just so excited they had the work done. They never even bring that up, the cost. Where all they talk about is how excited they were that they had the work done and how beautiful their smile turned out. And that's really where the focus is. The most important things are relationships, and the relationship to my, with my family, with my friends, with my immediate family, with my wife and my children are of utmost importance to me. But the other thing is, as far as relationships go, when I see these patients, I want to have not only a relationship where we're doing the treatment, but I want to have a relationship for life. I want to be able to see them 5, 10, 15, 20 years later, and always have a bond with them. And so creating those bonds and those relationships that I have are very important to me.
Before I met Dr. Krauss, I used to cover my mouth all the time, and I was always very self-conscious of my smile. Now I can smile and don't worry about it anymore. I feel anyone that has to have work on their mouth and have been unhappy like I was with several dentists, they should call Dr. Krauss, give him a chance at it. Come in. And I think they'll see a big difference. All my family members have noticed a difference. And time I smile now, people just, a lot of my relatives, they say, oh, your teeth are so pretty, I used to always cover my mouth. And now I'm a different person. And I'm very happy I came.
I came to see Dr. Krauss because I noticed an ad he had in the paper about enhancing your smile. through various techniques, and that's something that I'd really wanted to do because my teeth were getting to be pretty worn down from a serious bite problem, and I wanted a nicer smile. He replaced the worn teeth with new crowns so that I would have a nice new smile. Oh, I would definitely tell him to come see Dr. Krauss. I think that he has a great deal of professionalism. He wants to work with you to get the best results that you can. Everyone in his office has been very, very friendly and helpful also, and they've all made me feel very much at ease.
If it were me looking for somebody who's going to take care of my smile, coming from my point of view, first of all, I want to make sure that I feel that they really care. And I want to feel like they can make a difference for me. I don't want to feel like I'm going somewhere where I'm not getting what I want. If I know the person cares, then the chances are, if they have the skill and ability, they're going to deliver. And that's precisely what we do here. First of all, we truly care. Second of all, we know how to provide that care, and that's going to ultimately give you what you want. Another thing is there's no teacher-like experience, and having done a variety of cases, and not any one case is exactly the same, and we've taken patients that have different problems. I mean, everyone's different, but we're able to give them the result that they want, the results that they're happy with, and that I'm happy with, and that I'm proud to put my name on. And this is one thing I tell my patients all the time, is their smile is my signature. That is, when they say, where did you get that done? Well, I had that done with Dr. Krauss. And the biggest compliment to me is when a patient is able, with their smile, and somebody doesn't even realize that it was done, by a cosmetic dentist, that they just have oh man, you have a beautiful smile. Well, actually Dr. Krauss is the one that helped me have the smile that I have. Oh, really? Yeah, well, I couldn't even tell. This looks so natural. There's a few things that we'll do for a patient. One is we have before and afters. In other words, you can actually see the results of the work from where the patient was before. The other thing that we offer is our patients are more than glad to give a testimonial. And so in other words, a patient who's contemplating the work can actually call some patient who's had the work done before, and ask them about their experience and how they feel about it. And I think that's powerful, because that then is somebody they can relate to who's been through it before.
Now that I've had veneers, I would definitely say it's well worth it, and to definitely go talk to Dr. Krauss. I smile more every day. Every day. I take lots of pictures. I loved pictures from before, and now I don't have a problem. I used to have a problem where I couldn't take pictures because I didn't want to smile. I would almost be in tears every time somebody asked me to smile when I was taking a picture, so pictures just were not my thing at all, and now I have tons of them.
Everyone noticed. I even was told I looked 20 years younger, which I think was a lie, but it made me feel better. I didn't think it was that bad until I had the work done, and I actually saw a camera close-up of my teeth, and it was so sad. So I had it done, and then after that I had an appointment with my physician, and she saw my teeth, and she just went on about it. She wanted to know who did my teeth. I gave her the doctor's information. I believe she's going to come and see him.
I'm here today with Brian, and Brian has expressed he's unhappy with a smile, and so I'm just going to get right into it. Brian, can you tell me in your own words what you would do to improve your smile?
Yeah, there are a couple things. Number one, I had orthodontia when I was younger,
okay.
But my teeth are kind of growing apart now, and there's some gaps that I'm not happy with. I'm also not happy with the color and kind of the shape. I don't want really big teeth, and I want those horse teeth veneer kind of things, but I want something that looks natural, but just better.
Right.
I just want a better smile.
Brian, let me go ahead and let you look through this guide so you can start to choose which smile you feel would fit you the best. The thing that is really important is that I want you to feel like that you're a part of this process.
How long does something like this take?
The process is going to take about 2 or 3 weeks from beginning to end. And during that time, you're going to be wearing some temporary crowns and veneers.
Okay, temporary meaning what? Do I take them out at night or?
Meaning what we'll do is we'll actually design, no, you won't take them out at night. It's a good question. They'll actually be cemented in place just like the permanent ones, but they'll not be intended for the, you know.
And I can eat with them?
And you can eat with them. And
is it painful?
You know, pain isn't something my patients complain about because we're able to offer them oral sedation, laughing gas, and other ways of making them feel comfortable.
Okay. So now if I get veneers, can I pretty much eat anything that I would eat with my normal teeth?
Absolutely.
Okay, and how long will they last?
You know, with veneers are considered to be part of your teeth once they're cemented into place. And you can eat anything. Anything that's going to break a veneer is also going to break a normal tooth.
Okay.
And they should last you a lifetime if you take care of them.
So don't chew on lead pipes, is what you're saying?
Don't chew on anything like that.
I like this smile a lot. Is this something that would work with my face? And
actually, that's an excellent choice. The way your face is shaped and the shape of the teeth. And Brian, let's go ahead, get you scheduled for treatment. In 2 or 3 appointments, we're going to have you the world-class smile that you've always wanted.
Okay, great.
All right. My advice to someone who's unhappy with their smile is to go and do something about it. Come in and get a consultation and find out what your options are. Because until you do, nothing is going to change. As soon as you take action and do something about it, because I guarantee you we're going to be able to give you what you want. It's not always about veneers. Sometimes other options may be the way to go. For example, Invisalign, tooth whitening, or other minor cosmetic procedures that can be done to give you a beautiful smile. I would suggest that you get yourself an appointment, come in, let's meet one-on-one and help you to design the smile that you've always dreamed of.